Disease is the leading cause of death for men in the United States, and half of those deaths show no symptoms. And believe it or not, half of all Americans have at least one risk factor for heart disease. And it doesn't discriminate either. It is called the silent killer.
And with Father's Day this weekend, we want to help keep all the dads out there and everyone who has a dad heart healthy. Joining us this morning, cardiologist Dr. Anand Prasad. Thank you so much for being here with us.
Thank you for having me.
All right, when we talk about heart disease, we're not necessarily just talking about, the obvious heart attacks and the strokes. There are other problems as well, correct?
Right, so heart disease is a broad term. It's really cardiovascular disease, so disease of all the blood vessels. That includes risk of stroke, risk of heart attack, aneurysms, risk of peripheral arterial disease. They all are grouped together for cardiovascular disease.
And are they all pretty serious?
They are. Obviously, we get really scared about heart attacks, but there's a whole host of different vascular diseases that can cause chronic problems in patients.
How is it that you don't feel something? I would think in most cases, especially with a heart issue, you would feel that, something, not necessarily maybe a pain, but just something doesn't feel right.
Right, so symptoms can be very subtle. Shortness of breath, fatigue can be symptoms. We have so much diabetes in this community, and diabetes really hides those symptoms. Patients with diabetes don't feel chest pain. They don't have those warning signs until they actually have a heart attack.
What about risk factors? What are some of the biggest things to look for?
So again, modifiable things would be your diet, lifestyle, body weight, smoking. Those are modifiable risk factors. Other things that we need to recognize and control, again, are diabetes, kidney disease. Those are two big important things that people don't really appreciate, but over time lead to heart disease.
Okay, I know in the movies, when you watch a lot of times, you see people clutching their heart, or some of those things are obvious, but even though, sometimes you don't see the symptoms, there's got to be some sort of warning sign ahead of this happening. What do we look for?
I think we look at risk factors. So when you have risk factors of family history, a lot of different components that would put you at risk for heart disease, you get on top of those quickly. And you don't wait till you're clutching your chest and having a heart attack. But little things like shortness of breath, fatigue that's just not going away, get that checked out. Particularly if you're a middle-aged male or older male and you're having shortness of breath, decreased exercise tolerance, go get checked out. Get seen by a cardiologist.
If you do have it, it's hereditary for the most part. If you do have it in your family tree, do you recommend an EKG once a year, or how do you check? How do you make sure your doctor is staying on top of it?
Right. So, it's really recommended to have a lipid profile, so check your cholesterol once a year. Be screened for diabetes. You can have diabetes for many years, or borderline or pre-diabetes, and not even know it. So getting screened for diabetes is very easy. It consists of a blood test, and it's really no reason why your doctor wouldn't do that.
Okay, Dr. Prasad, thank you so much for being here with us this morning. Happy Father's Day to you.
Thank you.
And have a great weekend.
Appreciate it.
6:26 right now. We're going to be right back.